And my name is Peng Yin, Dr. Peng Yin. I'm from Chinese Center for Disease Control and Prevention, and we just started to collaborate with the D4H on the SmartVA project. And we actually just completed the pilot phase in China. We have some barriers or challenges when we did during the implementation of VA for last year. I think the major challenge is the heavy workload we put on the interviewers, because these interviewers are all health professionals or health workers from local CDC or township hospitals, and they have already very busy with their routine work. So doing VA really will need them to have more working hours, and sometimes we'll need to do the VA during weekends or evening, because some of our respondents are living very far from the village center. It took multiple times to make appointments to all the best respondents. And another thing I want to mention is how to choose the best respondent. Someone who will look after this deceased person before his or her death. That would be the idea. So we really encourage the interviewers to make multiple attempts to get hold of the best respondents, because if you can get the best respondent, that is a key thing to make sure that you can get a good quality of the VA. And we also use some of our village doctors to help to make appointments, because village doctors are a crucial part in our process, because village doctors are respected people in the village, and he or she knows everybody in the village and people trust them. So with the help from village doctors, the interviewers can make appointments to select the best respondent, and then the interviewers will carry their tablets to go to the household to carry out the interview. We don't have any problems with adults, but for children, because that's really is something you don't want to remind the respondents that their beloved person, the child died. So we got a relatively higher rejection rate for this age group. And also another issue is the language issue, because obviously we have the questionnaire translated into Chinese, but the process of data input, data export, and data analysis are still in English, which caused some trouble for our colleagues in the counties or some provinces, because they don't understand English at these levels. So we specifically set up a working group just to make sure there are people were there to answering questions, solve problems arising from the language, the English issues. Yeah, I think our data is actually pretty good, because we did this detailed evaluation, and we made a comparison with the comparator databases, and we have less than 10% of undetermined. And also when we look at the leading causes, and it's sort of as what we expect, and also it's in accordance with the GBD estimates. So I think the quality of our pilot is really good. Well, ideally we want to integrate all VA activities into our current, the routine surveillance work or death registration system work, but it is very difficult. And we actually have planned for another round of pilot, because China is a really large country. We have 31 provinces, and we really there are significant variations or differences across these different provinces in the east, central, or west. So we definitely need to pilot on more provinces, on more places, just to get the whole picture of China. And if after proper evaluation, if everything goes well, we are going to consider to roll out to cover the entire country.